Well, what I would tell you is that I think we did have an early strategy by the federal government. As you have heard President Trump say repeatedly, much to the chagrin of Joe Biden and many other Democrats around the country, he was very early to shut down travel to China, particularly the Wuhan region of China. I think that went a long way towards the fact that our models, which once projected between 250,000 and 1 million Americans dying from this horrible virus, has been reduced significantly, and certainly that has been the case in Mississippi. With respect to shortages of PPE, there is no question that that the country did not anticipate a pandemic the likes of which we haven't seen in 102 years in America. And so it did leave each of our states and our federal government scrambling to ensure that we had adequate PPE, that we had adequate ventilators. You know, that's the thing that I often find somewhat disturbing about this whole crisis is just a few weeks ago, and this is primarily dealt with the national media. The only thing the national media wanted to talk about was ventilators. We as a country were going to run out of ventilators, and that was going to lead to individuals in our country that could have been saved that were not saved because we didn't have adequate ventilators. Now we have states sending ventilators to other states, and we have our country sending ventilators to other countries. In our state, it was projected at one time that we would have approximately 1,000 Mississippians on ventilators today. I know yesterday, or the day before yesterday, we had 78. That may have upticked a little bit, 4, 5, 6, 8% in the last couple of days. But again, less than 1 in 10 what was originally projected. And that's because we have managed through this in a very challenging environment in the correct, proper way. And so I will tell you, the federal government has been a great partner for us. There is no doubt. You can look at states' testing numbers, and you can see which states were focused on testing weeks and weeks and weeks ago when some only wanted to talk about ventilators and which states were not. It is very, very evident that those states that were very early into testing, and I give all of the credit to Dr. Dobbs and his team. They have done yeoman's work. They partnered with the University of Mississippi Medical Center. They partnered very early with the University of Southern Mississippi and Forest General in putting together their testing sites and their testing capabilities. They were utilizing the state health lab for the most important cases that were already at hospitals. They had a testing strategy in our pandemic plan, and we executed it. That's what we did in Mississippi, is we executed our plan. And every single day, we're continuing to look at the data, we're continuing to look at the resources we have available, and we're continuing to execute our plan. And we're going to continue to do that until someone with a higher power tells us we can't do that anymore, because we are committed to get every single available resource to the people of Mississippi in as expedited a way as possible and get it to them so that they can use it now, not 8 months from now, not 8 years from now, but as soon as humanly possible, because now is when people are hurting. Now is when the people of my state, my constituents, are hurting, and I'm going to do everything in my power to get that done. And I'm going to work with our federal partners to make it a reality. You hadn't seen me sitting up here complaining about what the federal government has or has not done. Mississippians step up. We work with our federal delegation. We work with our federal partners. We work with the president. And when we can't get something from them, we figure out a way to make a ventilator at the University of Mississippi Medical Center with $50 worth of supplies from local hardware stores. That's what Mississippi is all about. And so I can't comment on these other states. Rob.